Today, I'm going to talk about semaglutide for longevity/anti-aging purposes. Newer studies have shown that semaglutide can be used to delay death, so to speak. It can be used to reduce the incidence of heart attack, reduce the incidence of stroke. It can reduce you ever having end-stage kidney disease. Heck, there's even some new preliminary stuff showing that semaglutide by itself could possibly even prevent Alzheimer's. By now, you've got to have heard of semaglutide or its name brand counterparts, Rybelsus, Ozempic, or Wegovy. Those are all drugs made by the company Novo Nordisk, and this drug belongs to a family called the GLPs. Semaglutide first started off as the branded drug Ozempic, and historically semaglutide was used to treat type 2 diabetes. Well, fast forward a little bit, and Novo Nordisk rebranded that as Wegovy, and Wegovy is primarily used for weight loss. Currently, there's an investigation going showing that semaglutide can reduce the incidence of what's called a MACE, or MACE, and that's an acronym for Major Adverse Cardiovascular Event. And these include things like, for instance, heart attack or stroke. Now, from a statistical standpoint, 50% of diabetics will have some degree, some variation, some form of cardiovascular disease. Furthermore, 30% of those diabetics will die secondary to some kind of MACE or some cardiovascular related implication. The newer studies are showing that merely being on semaglutide can reduce the incidence of experiencing one of these MACEs. In regard to cognitive decline or cognitive impairment, newer investigations are showing that semaglutide possibly could reduce the risk of those as well. Since being a diabetic does increase your risk of developing dementia by 1.5 times, it's speculated that semaglutide could possibly reduce the risk of you ever developing something such as like a vascular dementia or something secondary to a major adverse cardiovascular event. As I just previously mentioned a moment ago, that's a MACE for short. Furthermore, there's a second mechanism of action in play. Semaglutide also has been shown to reduce the beta amyloid plaque burden that could possibly also contribute to developing something like Alzheimer's. In terms of life extension/anti-aging properties, it appears there's multiple mechanisms at play that we've speculated. The first is the most obvious one, which is weight loss. Besides tirzepatide, semaglutide's the best commercially available medication that's efficacious at weight loss. Furthermore, it's been shown to reduce postprandial glucose, postprandial lipoproteins, reduces your A1C, makes you more sensitive to insulin, reduces your insulin load. Also, it's been shown to reduce pro-inflammatory cytokines and reduce the oxidative stress on your endothelium, therefore protecting the endothelial lining of your blood vessels. In terms of dosing for anti-aging/longevity purposes, what's the best dose? Well, we don't quite know yet. Maybe it's the dose that has the best A1C reduction, or maybe it's the dose that has the best weight reduction. We don't quite know yet. And the reason we don't know is because despite all these different clinical outcomes, whether the clinical outcome is reducing incidence of heart failure or reducing incidence of end-stage kidney disease, multiple various doses have been used, and yet we're still seeing lots of positive clinical outcomes despite the fact there's multiple different doses being used. So it may be safe to speculate that you could still microdose it even if you're not losing weight, not really having an A1C reduction, and you could still possibly be benefiting from it because it does have all these pleiotropic positive effects.